plays such an integral role and infiltrates so many bodily functions, causes so many of the issues. Why do you think, what's your theory on why it's so heavily ignored by the medical community? I mean, why, it did take me so long, going since I was 4 to every single doctor known to man, and took me until I met you at 21 to get that. Why do you think that is?
Olivia, I have had so many patients tell me that their doctor looked at their blood test and said that your thyroid is normal. They say, but I have this and this. And he says, I'll give you an antidepressant. They do not ask the symptoms.
Yeah.
It's as simple as that. The symptoms are they don't have time. They only have so many minutes per patient. They don't have time to run through a whole list of symptoms, Do you have low sex drive? Are you tired and sluggish, lethargic? They don't have time to ask those symptoms.
Yeah.
So they go totally ignored. You go in sick and you leave sick. And if you have the symptoms, as I said before, and your blood tests are normal, you're put into a category where we can park the patients called subclinical hypothyroid. Subclinical hypothyroid means that you have the symptoms, but your blood tests are normal. We are not going to treat you. And that's how it's always been. So you are left as a patient to struggle through your life.
Yeah.
I mean, really, really struggle because there is no treatment. So you try and take things into your own hands. Sometimes you go to your pharmacist, go to your local specialty health food store, and you look for answers. You go on these special diets. Nothing's going to help unless you stimulate the hormone replacement, because your hormones are missing. It's as simple as that. You've got to replace those hormones.
Yeah. I mean, a lot of things I say to people, and from learning so much through you about the thyroid, is there's almost no point in doing so many of these things if your thyroid isn't good. It's like, okay, that's got to be, I mean, even you can go into, say, like, Maslow's hierarchy of needs, and you've got to have those foundational aspects before you can reach anything higher. And so you've got to deal with the hormones first. But yeah, and I think that, when you're saying about doctors not having the time, and I mean, I've worked in medical practices. That's where I met you, because you're coming through and doing the training on your Thyroxx machine. And it's unfortunate because, to get the doctor for a longer amount of time, usually it's the people that can afford to pay $600 a consult. But even then, the doctor might not actually care, or might not look into it, or might then just kind of go this long way around, put you on a ton of supplements without actually just it's almost, I felt, having the guts to actually just call it and say that this is what it is, this is actually what you're suffering with. That's what I felt. And then you came in, you were like, you're really sick. I'm like, yes, perfect. So yeah. So you just think it's just time and just not really listening to the patient, do you think?
No. And Olivia, we wouldn't be sitting here today if you hadn't had the benefits of being able to be diagnosed and put onto the right type of medications. Very important, the right type of medications. Because a lot of the medications that's used by regular GP practices are synthetic. They're not the right type. They don't do the patient very good, and usually they're underdosed. So you may get a little bit of help, but not the elimination of the lowering, substantial lowering of your symptoms.
Yeah. And at Trifixx, we're only going to help you if you tell us your symptoms. So that's what's the brilliant thing about it. Yeah.